An outbreak of Listeria linked to 3 deaths has health professionals on the alert today. The food bug has been traced to meat supplied to a Hawke's Bay hospital. One person also became ill and died in Tauranga 3 weeks ago after eating infected meat. So how concerned should the public be, and what sort of things do we need to watch out for? Dr Tim Blackmore specialises in infectious diseases at Capital Coast Health DHB, and he is with us now. Thank you for joining us this morning, Dr Blackmore. How concerned should we be, the general public? Should this be something we are taking very seriously?
To be honest, you shouldn't panic about it too much. We get very few cases in New Zealand a year, less than 20-25 cases for the whole country, and we only get 1 case a year in Wellington Hospital. So when you have an outbreak like this, it's an area of concern, but overall the average person shouldn't be getting themselves too concerned.
The general information we're hearing is that the people at high risk are those that are pregnant, those in hospitals, I guess, and the elderly. Is this true? Can you just recap that for us?
Yeah, sure. I mean, I just had a look at the cases we had in Wellington over the last 4 years, and that was exactly the way it played out. Some old people with cancer, a young person with an immune compromising condition, a baby and an alcoholic, and that's about the groups that you would expect to get Listeria, although very rarely.
Well, we're hearing 30 days for symptoms to actually show up. So if you are concerned that perhaps you have had a bit of dodgy meat, could you go in and get tested before the symptoms show up to see if you have Listeria?
Practically no. I mean, it's a bit of a difficult piece of advice to follow with it being flu season. So I think it's really that you have to limit it to people who are very unwell, receiving cancer chemotherapy or active treatment for arthritis or something like that. And then they should be in close contact with their GPs on a reasonably regular basis anyway. So GPs would probably have a lower threshold for taking a blood culture if someone has a fever, but it's really that combination of a fever and a pre-existing condition. The average person shouldn't go to their GP on that sort of basis otherwise.
Am I right in understanding that if you are a person in generally good health, you could have Listeria and not show the symptoms? Is that right?
Absolutely. It's a very common organism. It's present on vegetables and meat and what have you, but the amount in meat to start with is very much minimised by the way the food is produced and stored. The problem is that when people put it in their fridge, and they tend to think that preserved items that are smoked or preserved in other ways, that they can leave them in the fridge for a long time. So sort of anecdotally, the old people that I've seen with Listeria often hadn't been cleaning out their fridge, perhaps living on their own, and the advice was often to their daughter or somebody like that to go and help the old boy clean out the fridge.
So what would your advice be then for having those reheated meals? Because we have had a lot of feedback, particularly from pregnant women, that are understanding that if you really heat something up, some leftovers up to, really nuke it, that it's okay. Does that kill Listeria?
It should do. I mean, those sort of reheated meals, if they've been put in the freezer, that's the best thing to do, so that if you're not sure you're going to eat it within a day or two, then it's better just to put it in the freezer and then not worry so much, because by the time you've nuked it, it's probably not worth eating.
Okay, well, Dr Tim Blackmore, thank you very much for joining us this morning and that advice. So just to recap, here's what you need to know about Listeria. It's a bug found in dust, soil, water, plants, sewage and animal droppings. Health officials say it's dangerous for pregnant women, their babies, the elderly and people with a lowered immune system. Those at risk should avoid food like soft cheeses, processed meat and poultry, and seek medical advice if you develop flu-like symptoms such as a mild fever, headache, nausea, vomiting, aches and pains or a mild cough or cold.